Hello, everyone, and welcome to episode 5 of Cloud Class brought to you by Care Control. On the podcast today, we will be talking all things GP Connect. My name is Alicia, and I'm the marketing manager here at Care Control. It's fantastic to have you join us as we explore this exciting topic today. Now, firstly, we have a wonderful panel of speakers here with us. I'm thrilled to introduce Amanda, Care Control's Chief of Operations, who will be here to share insights into how we're supporting care providers with GP Connect here at Care Control. I'm also delighted to welcome our guest speaker, Alison Taylor, Senior Programme Manager for NHS England's Digitising Social Care Initiative, who will provide valuable expertise on the important project of GP Connect. Before we begin, let me quickly take you through our session's agenda today. We'll start with Alison with an overview of GP Connect and its importance. Following that, Alison will provide a deeper understanding of the benefits of GP Connect and the wider project from NHS England's perspective. Next, Amanda will guide us through the National Data Sharing Agreement and the activation process, helping you understand how you can get started with GP Connect through Care Control. We'll also be sharing some fantastic feedback we've received from some of our Care Control customers on their experience of GP Connect. And we'll also have a quick demonstration of GP Connect through the Care Control software. And we'll also have an overview of the support tools we have built for you to help you get set up and ready to go. We'll then end the podcast with a Q&A session from a few questions we've had sent in from our existing customers. Now to hand over to Alison.
Brilliant. Thanks, Alicia, and thank you very much for inviting me to come and speak to the GP Connect wonder that is. My name is Alison Taylor, as she said. I'm the Senior Programme Manager working in the Digitising Social Care team. I've been here for about 4 years now, working on implementing digital social care records, and my work stream is the standards and interoperability side. I am a nurse. I still work in care homes twice a month, and my passion and drive for sharing information, this has almost been my baby for 4 years, so I'm so happy to be here and sharing this information with you. So most of you here, I would have thought, want to know what GP Connect is or already have an idea. So it is the GP Connect, the information that's held in the GP system about the patients, your residents, about delivering care, really. It's available to all CQC registered providers now, and we've got a filtered access that Care Control have obviously worked hard and amazingly got over the line to share with you guys, and as we call them, non-clinicians or other healthcare professionals, as I like to say, can have access to this information to reduce your burden, and we'll move on to benefits in a little while. There's 2 important prerequisites for this. You must have an assured solution digital social care record in place, one of which is Care Control, which I'm here, and reaching standards met on the DSPT. Most of you hopefully know by now that it's really important to start this interoperability journey to sharing health data, and if you don't know, we can give further information, and there is free support out there for care providers to actually do and get through the Data Security Protection Toolkit. God, that's such a mouthful. DSPT. So yeah, reach out if you need any help there. Let's move on to the next slide, please, Alicia. So I mentioned a bit of this, who can access for what. It's a filtered access, read only, for all those job roles that you can see there. However, it's built on a role-based access control. That's what RBAC means in the slides. Realise that we've got an acronym there that I didn't spell out, so picking up my own inaccuracies. But obviously now for you guys, healthcare professionals that aren't essentially clinicians or registers as health call them, can access this information. Nurses can get access to the full record, and I believe Care Control is built to that, and it is available for nurses. However, a lot of nurses on this journey, if you're not used to seeing GP information, it's quite overwhelming. So they do start with a filtered access, and then obviously within their local arenas, discuss that and use it much more fully where they've got nurses. Where they haven't at the moment, they are restricted to just the filtered access. So, and we've got all the benefits that support that, which is why it's so exciting to be here to get you guys on board. What that actually means in practice for you is that you get to see the last 3 encounters or visits, as we would call them, to GP practices to see any healthcare professional. So if they've gone to see the nurse, the GP, or physiotherapist, even now you get encounters for. It will tell you, it will raise questions or it won't, but it will give you information which you've not had before. Active problems and immunisations, says what it does on the tin, lets you know if they've had the vaccines, especially the last few years, as we know, with COVID and flu rife at the moment, and several different strains. So immunisations are really important. Medications, I don't need to speak to you guys about safeguarding and things that we have to do and see around not sharing information around meds. So, you know, this is available. It's probably the key benefit of the information that's available to you guys at the moment with your daily work and admissions and discharges and transfers. And, you know, I really do know I've been there, not for a while, because when I go into the care home, I am a nurse, but I have a care home manager hat and a clinical manager hat in care environments. So fully drive this, and that's where my passion comes from. Allergies, I think I don't need to explain to that. We all know what that is and how important that is. And that can be important to several members of staff within your care environment, from the gardener all the way up to the home manager and regional managers. Allergies are so important with activities that we do, cooking, gardening, watering plants, all those sort of silly things that we don't necessarily think about if we haven't got allergies, but it's important to know about when we care for people. And then what have I put in the green box? Okay, so from March 22, we've now got 8 suppliers actually on continuous delivery. So that's my mistake. We've been working this up for a while. So yeah, I can happily say it is 8 now. And April 24, again, we've got 11. So 8 on delivery, 11 over the line with assurance and working to go live. And that's a whole lot of technical go live, because it's there. It's just a whole load of work that Care Control's been through. So yeah, positive trajectory is going up and has been since March 22. If we can move on to the next slide, Alicia, please. So briefly touched on this about the GP Connect benefits. There's system benefits, there's experience, there's people and care experience, and there's people outcomes. I probably don't need to speak to you guys about all these benefits. You can read them yourself. I think the biggest benefit for me operationally is saved phone calls. Not getting wrong information and acting on that, which could create safeguardings, and you just have the information at hand. So, you know, I'm not going to talk you through this slide in detail. I think if there's any questions or you need any more work from it, then come back to us, because there's a whole load of work going on around GP Connect and benefits at the moment anyway. Yep, next slide for me, Alicia, please. So these are some of the testimonials that I've received over the last 3 or 4 years. There's probably hundreds more sitting in my emails that I haven't pulled out, and hoping Care Control will speak to you guys and get your own testimonials when you go live. And if you have gone live, because I know a few of you have, then you can give your story and your testimonials, which is coming up as well. So this is just going through again, not calling the GP for information. December again, because GP Connect was available. They were able to see past medical history of a pacemaker, so that they could act on that. So this is real rich information as to why we're doing this. So yeah, move on, Alicia, I think. So this is where we're at. Actually, we're further than this, because I can send you an updated reference slide for when we send this out, because I've got some figures until June now. So we have improved. We've gone up to just over 2,000 sites. I don't want to quote myself and be wrong, but it's around 90,000 people and about 12,000 staff. And the one for me, yeah, we all love a number, but the fact that 10,000 new staff have come to digital, that doesn't just give them the information, that empowers them, that gives them sort of like ability to do digital and not say, oh, I don't know if I can do that, because they want the information. It improves their day, you know, and everybody looks for something good in their day, even if it's 1 or 2 things, and that can be accessing information when you're caring for people. And building confidence in people to care on information. So, I will send Alicia you details to update, and obviously you can edit what you like, but I am really happy with where we're at. I think the next 3 months will go even higher because new suppliers like you guys are coming on board. So the end of March we will have some real good implementation data to end the financial year with, to then there'll be a work package in the next year with digitising social care, and that will be supported with you guys as well. So as we get the information, we'll continue to work on this so the numbers fly up there, so that all care providers have access to this information no matter what digital social care record they're using. I think that's enough on the implementation data, and I'm handing over to Amanda.
Thank you, Alison. A pleasure to be with you all this morning, and thank you for dialing into our webinar. My opportunity to introduce you to the aspects from care controls perspective and help you understand how you can easily onboard with the software for accessing GP Connect. So let's begin first of all by understanding the process for activating GP Connect. As Alison alluded to, the first stage is to complete your Digital Security Protection Toolkit, the DSPT. This enables your organisation to meet the NHS digital safeguarding security standards. But not only is it just about compliance, it's also about strengthening your cyber security practices and ensuring safe handling of patients' information through GP Connect. The next part then is to sign the NDSA. Now this is essentially a formal agreement that you're signing to detail acceptable use of the data from GP Connect and the users that are using and accessing that data through GP Connect. It ensures data protection standards and acceptable use and safeguarding of patients' data, and it's just a formal agreement that you need to complete with the NHS to enable you to then build on accessing the requirements for GP Connect. So once you've done your DSPT, now I can't say it, once you've done your DSPT and you've met the submission of standards met, and you've signed off the NSDA, that's not right, NDSA, sorry, NDSA, and your CQC registered, you can then apply for GP Connect. So basically what you need to do at this point is simply provide your care control name as your software provider for GP Connect and your ODS code. State the reason why you need GP Connect and confirm that you've signed the NDSA agreement. You'll also need to submit some key signatory details such as your data protection officer information. And then basically you'll be connected with Care Control to sign you across to GP Connect. We'll do all the hard work. You simply just need to give us those 3 bits of information above, and then we will sign you across and enact you to Care Control and GP Connect. We have some designated information on our website page that you can apply to look through our CC Learning Hub, Care Control Learning Hub, and that enables you to complete the information that we supplied in upskilling you through an e-learning platform. It'll help you face any questions or queries you may have with the activation process, and we'll cover that in a little bit more detail in the slide shortly. Obviously, if you encounter any challenges, Care Control is here to assist you with the activation process and provide you with guidance throughout, so please don't hesitate to reach out. Thank you, Alicia. Alison's got a hand.
Hi, Alison.
Just before you move on, just 2 points. I'll pick up tips. The reason why in the NDSA a lot of people stumble on, so I just wanted to say that it was the reason why you're doing it is direct care. That's your legal basis, and when you go through it you pick social care, and when you pick social care we've already written you a pre-written reason why, and you just agree to that. But a lot of people don't know to click the social care button or direct care as the legal basis, so I think that's just a really good tip when you're going through. It's a frequently asked question that we've had.
So let's move on to some essential tips that we've kind of can give you ourselves, but also we've received from our customers as well. So I'd like to start by sharing some feedback with one of our customers, Springhouse. Vanessa, who is the registered manager at Springhouse, said that GP Connect has been a game changer for her dementia care home. The seamless integration of care control systems has made accessing vital GP records incredibly straightforward. The setup was surprisingly simple and the onboarding process couldn't have been easier. Care Control guided us every step of the way through their online portal and training area. Thanks to GP Connect, our team now have real-time access to important medical information, which means we can provide more personalised and timely care for our residents. We couldn't recommend it more. Prior to Springhouse going live with GP Connect, there was a lot of anxiety around getting set up on GP Connect. Also feeling like it could be a little bit too time consuming. People felt like they were very busy. And I think as well, when you look at it from an outsider's point of view and see how much you have to do to get set up, it looks like a lot. But realistically, once Springhouse got started, they realised it was actually quite simple and they were up and running very, very quickly. So what I'm going to do now is I'm going to hand you over to Kieran, who's popped together some videos showcasing our online portal, but also showcasing the GP Connect system through Care Control as well.
Welcome to GP Connect and You, the latest course from Care Control designed to empower care providers with seamless access to GP information. This course provides step-by-step guidance on how to set up and use GP Connect, ensuring you can access vital medical information directly from within the Care Control system. Learn how to quickly connect your system to GP Connect and begin viewing live medical records at the click of a button. Understand how to navigate the system efficiently and access information such as medications, allergies, and care notes. Interactive modules and quizzes ensure you retain the knowledge to apply it in your role. GP Connect allows you to make better care decisions by providing real-time access to essential information. Save time by eliminating manual processes and reduce the risk of errors in your records. GP Connect is an innovative feature that enables users to access GP practice clinical read-only information through Care Control Cloud. First, navigate to the Care Plan section. Then, open the medical drop-down menu and select GP Connect. On the Summary tab, you'll find an overview of the last 3 encounters, active problems and issues, major active problems and issues, current allergies and adverse reactions, acute medication and current repeat medication. On the Encounters tab, we'll list all past encounters. The Clinical tab makes it able to view important items such as test results. The Problems tab displays current issues, major and historic problems. The Allergies tab shows both current and historic allergies. The Medications tab includes acute medications, current and past repeat medications, and any other medication. The Observations tab lists any potential issues being closely monitored. The Referral tab displays any doctor or hospital referrals. The Immunisations tab details any immunisations the resident has received. The Administrative tab contains all relevant documentation, such as appointment letters. This organised layout makes it easy to access and review all critical medical information efficiently. This service is designed to enhance the efficiency and quality of patient care by providing timely access to medical records and improving coordination among various care providers. As staff members use GP Connect, they will encounter personal, sensitive, and health data of patients. Therefore, adherence to GDPR and information governance rules is essential. To ensure compliance and manage any arising issues, Care Control recommends designating a privacy officer within the organization. This officer will oversee staff training, track compliance status, and handle any concerns related to GP Connect.
Brilliant. Any questions ourselves before we move on to questions sent in from our customers? Fantastic. Okay, so one first question we had sent in was, how do we get set up with GP Connect in our care home? Is it a complicated process? Amanda, I think you might be best to answer this one.
No, it's really straightforward. As I alluded to in the earlier slide, it's a couple of steps. Firstly, starting with that digital security protection toolkit, having achieved standards met, you then need to sign that formal agreement with the NDSA, basically ensuring that you agree to the governance and rules behind operating GP Connect. You then send us that information along with your ODS code, and then Care Control, as an assured supplier of GP Connect, will activate you and get you set up.
Brilliant. Alison, a question for you now. Why was GP Connect created, and how does it benefit care providers like us?
It was created from my brain because when I came to adult social care about 4 years ago now, I was already doing a project sharing information, but it was very much a medium step. It wasn't the long term, which I knew was standard. So I fought for change through NHS England, RCGP, my passion for access to information as a nurse for the last 20 years being in digital, and we still have way to go, but this was the baselining for getting culture change as well. As we know, the old culture, there is still some around, but very little, I have to say, in sharing information. It's got to be the right person at the right time for the right reasons, obviously, all the L's. But that's where the passion grew for me about 4 years ago. Obviously, just before COVID, I was doing sort of like similar projects. And then I was able to take my skills and work nationally to scale it. Then joined the program with you guys and went, well, this is what we need to do, and have driven that for the last 4 years with market assurance team, working with our assured suppliers, and yeah, that was it. That's where it was initiated, obviously, from just me being in digital and NHS England looking to want to share, and COVID drove a lot of. It was painful, and it was a hard journey, but one of the advantages of COVID, and there's not many, was that it did drive digital and funding and the gaps in social care. So I was able to get that influence in there and just work to get where we are, really. And there will be further change, further information coming for carers, because like that demo I loved, by the way, was great. I love seeing all the different systems because I don't get to sit in detail, and it is really easy. And things like when you go to documents or referrals, I think sparked a thing in my head. When you go to referrals, you can see that they've had a referral, but not yet, you can't open the document. So there's no PDF attachment or anything you want. That is the future. Interoperability is coming with more health information. So it won't be the be all and end all. It is the start of a journey that should have started many years ago in sharing, and hopefully making your everyday lives a bit easier without having to make phone calls to find information about people you care for.
Brilliant. Just off the back of that as well, we had one of our customers who's domiciliary and home care based. They've asked, is GP Connect suitable for all care providers, or is it just for care homes?
Absolutely, all CQC registered care providers. I got out of the culture of just saying care homes about 3 years ago when my projects went from care homes, because I acknowledged that we have always started there. Home care is a very different beast and very complex. But as I drove these projects to scale, I was very much passionate about, right, we have to address the gap in us with the CQC registered, and so I can honestly say it's for any environment, any specialism. It's information about people you care for, so it really can't not be beneficial. So happy to say yes, it's all CQC registered providers, and the conversation is happening about those that are not registered, just in case there's some people listening that have come from non-registered environments that are out there.
Fantastic. And then a question for yourself, Amanda. Does it cost us anything to get set up on GP Connect?
No, I'm delighted to say access to GP Connect is included as part of your care control agreement, so there's no additional costs.
Fantastic. And final question, how secure is the information accessed through GP Connect? Alison or
That one for
Amanda on
me?
that one? Yep, Alison, yep.
I could be flippant and say if you're on paper, much more secure than that. And I've worked on IG for nearly 7 years to get where we were for the NDSA. So it's a really simple process. It's completely secure. There is an opt-out. So if your residents a long time ago opted out for information for whatever reason, it can be revisited and they can opt in. There's less than 1% that opt out. So yeah, secure. It's a no-brainer, guys. Go get the information, which improves your care and gives time back to care. So it's multifaceted. So yeah, please don't worry about IG. I've done that for forever and now I don't. So yeah, it is really secure.
Fantastic. Brilliant. Well, is there anything else from anybody else today, or are we happy to end today's session? Fantastic.
No,
Brilliant. Well, thank you very much for joining us today, Alison. It's been really insightful. All the information within the slide deck today will be linked in the description, but we'll also have it on our Learning Hub as well. Thank you very much for joining us.
Thank you.
Thank you.